Канал Да English представляет «Говорим о здоровье на английском». Всем привет на канале Да English, с вами Анна Дудник и новый тренажер. Сегодня мы будем говорить о здоровье. Друзья, я искренне желаю всем крепкого здоровья, но нужно уметь говорить о своем здоровье и о своих проблемах, связанных со здоровьем, с врачом на английском. Итак, первая часть будет состоять, как обычно, перевод с русского языка на английский, а вторая часть – это real life situation, когда вы пришли к врачу и рассказываете о своих проблемах со здоровьем. Постарайтесь отвечать вот точно так же, как бы вы отвечали у реального врача. Итак, желаю хорошо попрактиковаться вам, запомнить английские фразы, слова и не болейте!
Symptoms. What are your symptoms? How long have you had these symptoms for? Ache. I have the ache in my side. I have an aching pain here. Headache. I have a bad headache. How long have you had this headache? Toothache. Have you been to the dentist about your toothache? Where is the toothache? Earache. I have had an earache for a week. Pain. Where is the pain? How long have you had this pain? Stabbing pain. Is it a stabbing pain? There is a stabbing pain here. Sore throat. Do you have a sore throat? How long have you had a sore throat? Chest pain. Are you experiencing any chest pain? I have had some chest pain. Stomach pain. Where are you having the stomach pain? I have had stomach pain for a week now. Illness. How long have you had this illness? Trauma. Have you had any head trauma? Wound. How did you get the wound? I will need to clean the wound. Infectious. I believe you have a chest infection. Your virus is infectious, so be careful. Viral. You have a viral infection. Rash. Can I see the rash, please? Do you know what could have caused the rash? Fever. You have a fever. I think I might have a fever. Temperature. Do you have a high temperature? Can I take your temperature? Runny nose. I have a runny nose. Sneeze. I need to sneeze. Cough. Can you cough, please? When did the cough start? Hiccup. I have the hiccups. I know how to get rid of hiccups. Convulsion. When did the convulsions start? Spasm. My muscle just spasmed. Suffocation. Are you feeling suffocation? Seizure. Have you had a seizure before? What you experienced was a seizure. Faint. I am feeling faint. Do you feel faint? Burning. I have a burning sensation. My hand is burning. Vomiting. Have you been vomiting? I have been vomiting all night. Nausea. Have you had any nausea? I am feeling very nauseous. Bleeding. My hand is bleeding. Swelling. This will help with the swelling. My hand is swelling. Inflammation. Take this to help with the inflammation. Constipation. I am feeling constipated. Have you had any constipation? Heartburn. I get really bad heartburn. How often do you get heartburn? Treatment. The treatment will take 3 weeks. Cure. Not to worry, there is a cure. Care. Do you need help with care? Dizziness. Have you experienced any dizziness? Nasal congestion. Have you had nasal congestion? Chills. I have been getting the chills. Fatigue. Any fatigue? I feel very fatigued. Weakness. Any weakness? Drowsiness. This medication can cause drowsiness. I have been very drowsy. Depression. Do you suffer from depression? Shortness of breath. Have you had any shortness of breath? Blood pressure. Do you have any issues with your blood pressure? I have high blood pressure. Eating disorder. I have an eating disorder. Corn. I have a corn on my foot. English speaking practice, real life situations, visiting a doctor. We all love going on holiday. They offer such a precious opportunity to relax and create cherished memories with our loved ones. However, unexpected situations can arise. What if a member of your group suddenly falls ill and needs medical care? It's easy to do this in our own language at home, but what do we do abroad? Would you be able to communicate effectively in English with a doctor? English speaking practice, real life situations, visiting a doctor. Imagine the situation you're at a doctor's appointment with a sharp stomach ache. Begin the dialogue with a greeting and ask permission to enter. The doctor asks standard questions such as what your complaint's about, your name, age, if you have a temperature. You should give answers to the doctor's questions in your pauses when you see the word patient on the screen. Try to give your answers within the allotted time, but if you need more time to answer, you can press pause at the end of the speaking practice part. You will see the whole dialogue on the screen. We wish you success on the speaking practice part.
Good morning to you. Yes, please, come in and take a seat. What has brought you here this morning? Well, could I get your name and age, please? Tom, do you have a temperature? Tom, you should lie down on the couch. I will examine your stomach. Please, just try to relax. Do you feel pain if I press your lower stomach on the right? I see. The nurse will take a blood test, but I can assume you have appendicitis. I'm afraid you need an urgent operation. Do you have insurance? Tom, I hope that in 5 days after the operation you will be at home. I believe that you will be able to go on holiday if you follow my instructions.
Did you get it right? I'm sure you did. Now, listen to the dialogue.
Good morning. May I come in, Doctor? Good morning to you. Yes, please, come in and take a seat. What has brought you here this morning? Oh, Doctor, I have a sharp pain in my stomach. I could not sleep all last night. The pain drove me mad when I was trying to turn over in bed. Well, could I get your name and age, please? Yes, sure. My name is Tom Keane, and I am 25 years old. Tom, do you have a temperature? Yes, I've checked it. It is 37.8. Tom, you should lie down on the couch. I will examine your stomach. Please, just try to relax. Do you feel pain if I press your lower stomach on the right? Ah! Doctor, I can't stand the pain. I see. The nurse will take a blood test, but I can assume you have appendicitis. I'm afraid you need an urgent operation. Do you have insurance? Yes, I do. I'm planning a holiday trip with my girlfriend next month. Will I be able to travel after the operation? Tom, I hope that in 5 days after the operation you will be at home. I believe that you will be able to go on holiday if you follow my instructions. Thanks, Doc. You cheered me up.
To be continued. Stay with us and enjoy your English learning.